Hello, my name is Marian Apellanis, and I chose to do my presentation on the low-fat dietary pattern and risk of invasive breast cancer study. I work in a cardiovascular disease and stroke hospital, and so most of my patients are on high-fat diet, so I figured that this would be a interesting subject to look at. Okay, so the population of this study were postmenopausal women. They were between 50 and 79, and they did not have a baseline history of breast cancer. The intervention was a low-fat diet. It was made to reduce about 20% of total calories intake taken in from fat. They also focused on the increase of fruits and vegetables. So there was 5 or more servings included of vegetables and 6 or more servings included of grains. They also had 18 behavioral modification sessions in the first year, and then after that they had quarterly sessions. So that was the intervention group. The comparison group, they were participants who maintained their usual dietary habits with no changes. They did go to health-related sessions, but there wasn't any specific diet aimed towards them. The main primary outcome of the study was invasive breast cancer, but there were secondary outcomes measured like tumors or tumor characteristics, total cancer incidence, and then they did do a subgroup analysis on adherence and compliance with the intake of fat. They did look at other markers like cholesterols, fat markers in the diet. They looked at some hormones and things like that. They did look at BMI, but those were not outcomes they were not the main outcomes that the researchers were looking at. It was mainly the incidence or not of breast cancer. Okay, so a little bit about this study. There were 48,835 total participants. There were 2 groups. So the intervention group was 19,541 participants, and the comparison group was 29,294 participants. They were all randomized into the 2 different diet groups. So one of them, like I was mentioning, is the intervention group, which is the low-fat diet group, with the sessions and the sessions with the dietitian and the information that was given to them on the low-fat diet. And then the comparison group, which were the 29,294 patients, they were just on their usual diet. They did get dietary guidance, but they weren't put on any specific diet. Now, because this study was through a long time, so it was 8.1 years, they had to adhere to the diet and attend these sessions. Then they were not able to blind the study for the participants or for the researchers. However, there was a group of researchers who were trained, and they were looking at some of the outcomes and the medical records. And for this reason, that helped the results be more objective. The participation the participants were closely looked at, and so they were very similar. They were similar in terms of prognosis. They all had to have a life expectancy of over 3 years, and there were very specific inclusion and exclusion criteria. All of the women that were included had to have no baseline history of breast cancer, and they also had to be able to adhere to the diet. So some of the exclusion criteria are other diseases that would impede them from being able to follow up closely, to follow up for these 8 years, to adhere to the diet, any strong medical conditions, any dietary patterns that they had to medically follow that would impede them from being able to follow this certain diet. And like I said, they were all postmenopausal and needed to have a prognosis of more than 3 years with a very important no baseline of breast cancer. Okay, so the major outcome that was looked at this study was invasive breast cancer. There were different things that were looked at. They did look at different tumors, the growth of the tumors, what tissue the tumors were made of. They did look at mortality rates, and they looked at total incidence of cancer. However, their main outcome here was breast cancer, which is why that's the one that I focused on. So they did have a p-value of 0.07, which we can see right here. I do want to apologize here in the confidence intervals. This number is supposed to be 1.01, so I corrected that in the paper that I did turn in. So I didn't want to say that, and I'll show it in a later slide. So we do see that there wasn't a statistical significance here with a p-value of less than 0.05. There was a hazard ratio of 0.91. With the confidence intervals, again, it was 0.83, and this one is 1.01. So it does in fact cross over 1. So it only suggests a 9% reduction in breast cancer. However, because of the amount of time that was done for the study, which was 8.1 years, it did show a trend towards a reduction of breast cancer. And they also did a subgroup analysis. And in that subgroup, they took ladies that their baseline intake of fat was higher, and their adherence to the diet was high as well. And in that subgroup, they did see a higher reduction risk of breast cancer. So we can see here how this could be, or this is a good initial study. And with the subgroup analyses that they did, more research could be done from there that could potentially show more significant results. The outcomes that were looked at were clinical. However, they were some physiological outcomes. Like I was saying, they were looking at hormones, mainly lipid panels. So they did look at physiological ones, but they weren't the ones that were mainly focused on in this study, which you'll also see in a later table. There weren't any adverse effects in this diet, and it's a low-fat diet, was generally well tolerated. They didn't see any adverse effects with it, like I said, or any major health issues that were directly attributed to any dietary changes. I wanted to include this forest plot so we can see right here that here is our one line, and all of the studies basically don't cross the line, and they do form a fairly straight line over here, or as straight as we would want it to be. So we can definitely see that they did use data that was well included in the study as far as the participants. I wanted to show here my calculations. So we've got my CER, my EER, relative risk, my relative risk reduction, my absolute risk reduction, and the number needed to treat ended up being 333. And you can see the p-value here of 0.07. And I will show in the next slide the table so y'all can see. So here is my primary outcome table. So we can see here the incidence of breast cancer, and this was in the intervention group, was a total of 655. In the comparison group, it was 1,072. So here's where we can see our main p-value that was looked at. This was the main primary outcome of this study, is that p-value of 0.07. They looked at mortality in relation to breast cancer. I did my calculations based on the incidence of breast cancer, since that's what they were mainly looking at. But of course, looking at these tables, there's other things that we could have calculated as well. They did look at total cancers, which was my 1,946, in comparison to the comparison group, which is 3,040. However, that p-value is 0.15. Again, we've got some mortality here, our total mortality, and our global index. So we do have our incidence of breast cancer with the lowest p-value of 0.07, but there is no statistical significance there. However, the confidence, we can see here in the hazard ratio that it is 0.91, and our confidence interval is 0.83 to 1.01. Three major takeaways that I took from this study is that the study does show that there's a possibility that a low-fat diet could potentially reduce the incidence of breast cancer in postmenopausal women. Although it didn't reach statistical significance, they did do that subgroup analysis that I was talking about, where a baseline fat intake that was higher and an adherence that was higher to a low-fat diet did show other results. A low-fat diet may not be enough to reduce the incidence of breast cancer alone. However, if we pair this with lifestyle changes, then it could show potential benefits to these postmenopausal women, which I think is very important, right? And, a lot of the dietary modifications that we do, those have to be paired with other lifestyle choices or with other lifestyle changes. And that's something that I talk about with my patients a lot. These are all changes that we do together in order to get one more major outcome, right? So maybe exercise by itself won't make all of the difference. Diet by itself won't make all of the difference. Even a medication by itself won't make all of the difference, right? A good example of this is, patients that are given insulin or things like that, but they're still not adherent to the diet. They don't have good blood glucose control, right? So similarly here, maybe just a low-fat diet won't be enough to reduce the incidence of breast cancer alone. But if we pair that with other lifestyle modification changes that we can make, then all of these small changes lead to one larger outcome, right? So it's the sum of the parts that create the major, bigger whole. And here is my source. And thank you very much.